Hello everyone, welcome back to Dubai Healthcare Consultancy. Dubai Healthcare Consultancy assists doctors, nurses, and allied healthcare professionals who are interested to start their career in Gulf countries like Dubai, Saudi Arabia, Oman, Bahrain, Qatar, and Kuwait. If you are interested to start your career in one of these countries, so Dubai Healthcare Consultancy is the best platform to assist you for your health authority registration, data flow verification, license exam booking. And Dubai Healthcare Consultancy will also provide you the exam material. These exam material will help you in your preparation for the upcoming Prometric Pearson VUE exam. Today this video is about to Assistant Nurse MCQs, and these MCQs are very important. If you will study these MCQs, I hope these MCQs will help you in your preparation for the upcoming Prometric Pearson VUE exam. These all MCQs are related to maternity and childhood section, which is very important section in the exam, and most of the question you will see in the exam related to maternity and childhood section of the curriculum. So I would request you everyone to watch all these MCQs. Do not skip. I hope that if you will watch these all MCQs, these MCQs will help you for your preparation of the exam. If you need more help, you can contact us on our WhatsApp number, or either you can call us and our team will assist you for the whole registration process regarding these Gulf countries. Let's go to the today MCQs we will provide you, and just our focus as I explained to you on maternity and childhood section. The first question is, which assessment pending is most concerns in a newborn within the first hour of life? As I told you, always read the question carefully and understand what the question is asking you. Then the fourth option 1 is acrocyanosis, option B is irregular respiration, option C is grunting with retraction, and option D is blood glucose level of 50 milligram per deciliter. So you need to carefully read all these options, compare these options to the question, and then decide using your clinical knowledge and your theoretical knowledge, clinical experience and theoretical knowledge. So always also cover the answer portion when you watch this video, so that will help you to decide on your own knowledge before you compare or the correct answer which is given to you in this video. So the correct answer is option C, which is grunting with retraction. Why this is the correct option? Because rational is grunting and retractions are sign of respiratory distress and required immediate medical attention. Let's move to the second question. Second question is, a pregnant client at 36-week gestation arrived at the clinic with complaint of severe headache, blurred vision, and sudden weight gain. What condition should the nurse suspect? These symptoms are present in a 36-week pregnant woman. So what condition the nurse will suspect? Simply understand the question, then go to the four option. Option A is gestational hypertension, option B is preeclampsia, option C is ectopic pregnancy, and option D is placental abruption. So give the time to yourself, study well, and decide the correct option. So the correct option is option B, preeclampsia. What is preeclampsia? Rational is these symptoms are classical indication of preeclampsia, which can lead to serious complication if not managed. So that's why option B is the correct option. Now let's move to question number 3. Which immunization should be administered to a newborn within the first 12 hours of life? Option A, hepatitis B, option B, varicella, option C, MMR, option D, influenza. 12 hours of life which immunization will be administered? So the correct option is option A, hepatitis B. Rationale. The rationale behind that is where hepatitis B vaccine is recommended to be given within the first 12 to 24 hours after the birth of the baby. Let's move to the next question. Question number 4. What action should the nurse prioritize immediately after delivery of a newborn? Option A, assessing Apgar score. Option B, performing bundle massage. Option C, administer oxytocin. Option D, initiating breastfeeding. The correct option is option A, assessing Apgar score. So you need to find out about Apgar score, what is Apgar score, and how the nurse assess the Apgar score. So rationale is the Apgar scores help assess the newborn's overall condition and immediate need for resuscitation. Let's move to the fifth questions. The fifth question is, a mother asked the nurse about sign of effective breastfeeding. What is the best response? The mother asked about the sign of effective breastfeeding. What response the nurse will give? There are 4 options. Option A is your baby will latch on without difficulty. Option B, your baby's urine output will decrease. Option C, your baby will breastfeed for 10 to 15 minutes on each breast. Option D is your baby will gain 1 to 2 pounds per week. The correct option is option C. Your baby will breastfeed for 10 to 15 minutes on each breast. Why this is the correct option? Because feeding for 10 to 15 minutes on each breast is common sign of effective breastfeeding. Let's move to the next question. Question number 6. Which finding should the nurse report immediately during postpartum assessment? Option A, Lucia rubra on day 2nd postpartum. Option B, fundus palpable at the umbilicus. Option C, perineal fat saturated within 2 hours. Option D, urinary output of 40 milliliter per hour. The correct option is option C, perineal fat saturated within 2 hours. Why this is the correct answer? Because this may indicate postpartum hemorrhage which requires urgent or immediate medical attention. Question number 7. What is the most appropriate intervention for a newborn experience respiratory distress shortly after birth? Option A, positioning the newborn in a warm environment. Option B, administer oxygen via nasal cannula. Option C, providing chest compression. Option D, feeding the newborn to stimulate breathing. What do you think? Which one is the correct option? Option B is the correct option. Administer oxygen via nasal cannula. Rational supplemental oxygen help relieve mild respiratory distress and is a first-line intervention. Question number 8. During the assessment of a newborn, the nurse observed a positive Moro reflex. What does this indicate? A, developmental delay. B, possible birth injury. C, normal neurological response. And D, hypoglycemia. The correct option is option C, normal neurological response. Rational, the Moro reflex is a normal finding and reflects proper neurological development. Question number 9. What is a common complication associated with vacuum assisted delivery? Option A, increased risk of postpartum hemorrhage. Option B, risk of uterine rupture. Option C, neonatal scalp laceration. Option D, maternal infection. The correct option is option C, neonatal scalp lacerations. Rational, vacuum delivery can lead to scalp injury like abrasion or cephalohematomas in a newborn. The last question of this section is which statement Which statement by a breastfeeding mother? Understand of proper breastfeeding techniques. Option A. I should feed my baby every 4 hours during the day. Option B. I will supplement breastfeeding with formula to ensure my baby gain weight. Option C. I will offer both breasts at each feeding session. Option D. I will avoid burping my baby during night time feeding. The correct option is option C. I will offer both breasts at each feeding session. Ration, rational, rational is feeding from both breasts help ensure adequate intake and maintain milk supply. These are very important questions. Usually my candidates get these exam questions in their Prometric and Pearson VUE exam. So I would recommend to everyone try to read this question properly and subscribe to our YouTube channel so whenever we upload any video related to your profession, so you will watch out these videos, and I hope the main aim is to prepare you people properly for your upcoming Prometric and Pearson VUE exam. If you have any question or any inquiries, you can leave a comment and we will reply to your message. If you need to start your process for these Gulf countries like Dubai, Saudi Arabia, Oman, Bahrain, Qatar, and Kuwait, so Dubai Healthcare Consultancy is the best platform to assist you for health authority registration, data flow verification, license exam booking, and we will also give you the link of our website so you can go there, you can subscribe our question banks which contains more than 1500 and 2000 questions for the exam preparation. And if you study those exam material, I hope you will be able to pass your Prometric and Pearson VUE exam. Thank you so much for watching this video.